Good afternoon, and thank you all for joining us. I want to thank Dr. Mashika Roberts, Dr. Andrew Thomas, Dr. Bruce Vanderhoff, Dr. Nicholas Kriasoulis, and Dr. Rustin Morse, all that have joined us here today. I wish we were here to share with you good news, but we're not. In a few minutes, you'll hear from Dr. Roberts and the other physicians from each of our hospital systems about the dire situation our community is facing. Our cases of COVID-19 are spiking, both in Ohio and right here in Columbus and Central Ohio. And as we head into winter months without the option of being outside, we expect this to continue and possibly worsen. But there is a way forward and a chance for us to take control. We've done it before when we've seen spikes in March, in July, and I believe we as a community can do it again. But it requires us to be vigilant and recommit ourselves and those we love to this fight against the pandemic. I know we're tired. I know we're fatigued. I feel it. I know everyone in this room and community feels it as well. But it's not time to quit. First, stay home as much as possible. Avoid gatherings of more than 10 people. And try to keep those to people who you know have also been diligent in their efforts. Wear your mask when you're in public and when you're at the grocery store if you choose to go out. Wash your hands. And if you feel sick, stay home. Take your temperature and stay in touch with your primary care physician. Now, for more information about what they're seeing in the community, both from a public health perspective and from each of the health systems, first of all, I'd like to turn the podium over to our Health Commissioner, Dr. Mashika Roberts. Dr. Roberts?
Good afternoon, everyone, and thank you so much, Mayor Ginther, for all of your support through this pandemic. We are now over 7 months into this fight against COVID-19. I don't need to tell you all that these are very trying times. We appreciate all of you for helping us with this war by doing the 3 W's: wearing your mask, watching your distance, and washing your hands. But as the mayor mentioned, we are at a critical point in our fight against COVID-19, which continues to spread and is now increasing in our community. As of today, there are 24,953 cases right here in Columbus, eerily close to 25,000. And we've had 489 deaths of our residents, again, eerily close to reaching a milestone of 500. Our case numbers are going up again. Our highest number of cases continues to be among individuals 20 to 39 years of age, and we've had 4,000 cases in children 0 to 19. While these age groups often have mild symptoms, can even be asymptomatic, we know that they can spread this infection to others that are more vulnerable, like our elderly population and those with compromised immune systems, who are more prone to serious complications as well as deaths. We also know that this disease has disproportionately affected our minority communities. African Americans continue to be disproportionately impacted. While African Americans make up 29% of our population, they make up 40% of our hospitalizations. And Franklin County continues to be at the red level, or level 3, on the state's public health advisory system. Franklin County now joins 37 other counties in Ohio at level 3, which means that 74% of Ohioans are living in a high incidence, high exposure area of our state. Our case numbers are going up again, not only here in Columbus, but across the state. And as we head indoors and enter into the flu season, as well as the cold weather months, we must use every tool that we have at our disposal to fight this virus, to get our numbers to go in the downward trend again. I know many of us have COVID fatigue, but we cannot give up and become complacent to this virus. Anyone who is ill or who's been exposed to someone who has COVID-19 should get tested and self-quarantine or self-isolate. Thanks to our hospital partners that are here with us today, we have tested nearly 14,000 individuals right here at Columbus Public Health. Last week, we moved our testing operations to the Ohio Expo Center, the Celeste Center at the State Fairgrounds, so that we can continue to serve our residents as the temperatures drop and we have inclement weather outside. We want to do everything we can to keep our staff safe, as well as providing testing to our community. Contact tracing also remains critically important to our fight against this pandemic. If you get tested, you will be contacted from someone from public health. Please answer your phone. Please cooperate with us and give us the information that we need so that we can appropriately take care of you, as well as any close contacts that you might have been around. And of course, we have to continue to protect ourselves, those we love, and our community. And there's a few things I implore of all of you to do to help us achieve that. Wear a mask while you're out in public. Stay 6 feet apart from others. Wash your hands. Stay home if you're sick or exposed to someone with COVID-19. Get a flu shot. And do not gather with groups outside your immediate household. As a community, we have been effective in flattening the curve in the past, and we can do it again. We must do it again. We are at a critical moment, and we all must do everything we can right now to keep and get our kids back into the classroom, to keep the Buckeyes on the field, and to keep our hospitals from being overrun. So, as the mayor mentioned, this afternoon we are fortunate to be joined by our hospital partners, their chief medical officers. I also call them my personal advisors and support team. If we were a basketball team, I would call us the dream team. They're here to talk to all of you today about what they're seeing. They will each give a very brief update about what their individual systems are seeing and what their concerns are. And I'm going to ask that Dr. Thomas, who is the Chief Medical Officer from Ohio State University Wexner Medical Center, to begin. Thank you all.
Thank you, Dr. Roberts, and thank you, Mayor Ginther, for having us all here today, and thank you all for being here. I'm going to speak a little bit around the data and the trends that we're seeing across what's called Zone 2. As you know, the state is broken up into 8 emergency management regions for hospitals. Region 4 is here in Central Ohio, and Region 7 and 8 are Southern Ohio and Southeast Ohio, respectively. I serve as the lead for the Ohio Department of Health for Zone 2 and work a lot with over 40 hospitals across those 35 counties that make up the zone. Every Monday, Wednesday, and Friday at 9 a.m. we have conference calls where each of the hospitals in the zone that have coronavirus patients report in, talk to us about their capacity, talk to us about their census, and any resources they might need. And then throughout the week, the folks here from the Central Ohio Trauma System, which serve as our emergency management agents, are in contact with not just the hospitals, but the nursing homes, assisted livings, and other healthcare organizations across those 3 regions of the state to make sure that everyone has what they need moving forward. As you heard last week, both in the governor's press conferences as well as in what Dr. Roberts comments today, we are seeing a spike in hospitalized patients. In fact, today is the highest number of patients we've seen in the hospital in Zone 2 since May 9th. May 9th seems like a million years ago in terms of the way this pandemic has gone. In fact, if you take out the ODRC inmates, which are actually at a near low for what we've seen during the pandemic, we actually have the most patients in the hospital in Zone 2 today that we've had on any day in the pandemic, if you take the ODRC inmates out of the data. We've seen a 147% increase in the hospital census just in the last 5 weeks. And as I mentioned today, we're at 94% of our peak census from back in the spring. A couple key differences between now and where we were back in that March, April, May timeframe. I will say that the patients are distributed in a slightly different way than they were before. Some of our smaller regional hospitals and community hospitals, they might have had 2 or 3 patients in the hospital. Now they have 8, 10, 15 patients in the hospital in our communities, both around Central Ohio, outside of Franklin County, as well as in the rest of the zone. In fact, Region 7 has had a 500% increase in the hospital census over the past 31 days, and Region 8 today has the highest number of patients they've had in the hospital at any point during the pandemic, with a 422% increase from just 32 days ago. So we're seeing this trend not just in Zone 2, but around the state. Zone 3, which is Southwest Ohio, the Cincinnati, Dayton area, and the counties that surround those, is also at a peak of patients in the hospital. So that's essentially where we sit in terms of the region, and I'm going to turn the microphone over to Bruce Vanderhoff, the Chief Clinical Officer from Ohio Health, to go over what we're seeing here a little more locally in the Franklin County hospitals.
Well, thank you, Andy. One of the things I think we need to recognize is that Central Ohio has not been insulated from this most recent surge, a surge which admittedly now has, as Andy shared, incorporated much more regional activity. Hospitalizations in Franklin County haven't been this high since our summer surge. And our census most recently has hit a number of 190 patients. That is a substantial increase from our recent low just 36 days ago of 110 patients. As always, Columbus's hospitals and public health authorities have been working very, very closely together to ensure that even as we see these rising numbers, every patient in our community, regardless of their diagnosis, whether it be COVID-19 or something else, is able to receive the care they need when they need it. Our hospitals are coordinating the transfer of COVID-19 patients from outlying hospitals and emergency rooms to ensure that at any time, none of our hospitals is overwhelmed. Our health commissioner, we the CMOs, and other healthcare leaders continue to meet regularly to review data, to discuss challenges, and to coordinate how we are going to respond to everything from testing to vaccination. We continue to coordinate our response to surges like this one, and while we remain very confident in our hospital's ability to manage this current surge, we maintain readiness for much worse than what we're currently seeing. Bottom line is that while our hospitals are ready and able to care for the patients who need us, it is better for all of us if we don't need to go to the hospital. And therefore, we need your help in getting our numbers down and keeping our friends, our family members, our coworkers safe as we are heading into the winter months. And so with that, I'm going to turn to my colleague, Dr. Kratsoulis from Mount Carmel.
Thank you, everyone, and thank you, Dr. Vanderhoff. You've heard all the data, and you've heard the urgency regarding the data. My comments are reserved to our frontline staff and our first responders. First and foremost, I want to thank, and we all want to thank, every one of our frontline responders and first responders in the fight against COVID-19. We are deeply appreciative of your willingness to serve and care for the affected, even though caring for COVID patients may put yourself and your loved ones at risk. This includes physicians, nurses, hospital support staff, as well as our EMS, fire, police, and those who are risking their lives to protect the community. You are all heroes. We are grateful for your continued service to protect our community and to help slow the spread of the virus. If you are wondering how you can support our frontline staff and heroes, we need to ask that you continue to do your part as a community to curb the spread of the virus. If we remain vigilant and keep our infection rates down, we not only protect our friends and family, but we also protect our frontline staff. We continue to practice social distancing, maintaining at least 6 feet of distance in public settings. Wear your mask as already discussed and protect yourself and others from transmission. Wash your hands regularly. Avoid large gatherings and stay home if and when possible. I know the holidays are coming up, and I understand football and the urge to go see football games, but please remain vigilant. Remember, all games are home games. Less people sick means less people in the hospital, which means less risk to our frontline workers. If all Ohioans come together, we can help slow the spread of this virus and keep our communities and our frontline staff heroes safe. Thank you.
No worries, I'll introduce myself. Good afternoon. I'm Dr. Rustin Morse. I'm the Chief Medical Officer at Nationwide Children's Hospital. First, thank you, Mayor Ginther, for bringing us together, and thank you to my colleagues for your comments. I'm the newest member on Dr. Roberts' dream team, so that's why the introduction may have been forgotten. I echo their call to action and to remain vigilant to help control the spread of COVID-19 in our community. Our local pediatric data mirrors the national data. Children overall typically experience less severe illness than adults. However, some children are hospitalized and some require intensive care treatment. Furthermore, as Dr. Mashika noted, Hispanic and Black children have a higher COVID-19 associated hospitalization rates. Even if children don't get sick as frequently or as severely as adults, COVID-19 still has a big impact on their health and well-being, on their access to regular healthcare visits, on their educations, and on their ability to play with other kids and, well, just be kids. At Nationwide Children's, we believe in treating the whole child, and we remain concerned about the impact COVID-19 will have on children for years to come. Their health care, their educations, and their social and mental development may be impacted. Controlling the virus's spread helps minimize these broader effects. We encourage families to call their pediatrician to make sure their children are not missing important visits that could be critical to their physical and mental well-being. The more we, as adults, practice social distancing and wear a mask to reduce the spread of the virus, the more we protect kids, both directly and indirectly. They're worth the effort. Thank you.
Thank you again to all of these outstanding medical professionals who are part of the community's dream team in fighting the spread of COVID-19 and serving everyone in this community. Over the weekend, I watched the first Buckeyes game of the year, where I belonged, at home with my family. My understanding is there might be a big game coming up this Saturday night. And let me tell you where I will be, where I belong, at home with my family. And I want to encourage everybody in this community, and whether you're rooting for the Buckeyes or the Nittany Lions, that you do your part to protect the health, well-being, and safety of this community. And to make sure these student athletes have gone to incredible lengths to be able to compete this year. The least we can do is to stay at home, cheer them on, and to let them play. I saw some videos over the weekend showing that some of our residents did not follow the advice and guidance of these health experts. I know overwhelmingly there has been incredible compliance when Dr. Roberts and her team have visited establishments since the beginning of the pandemic. But it's critically important for us to recommit to what we know we need to do. We can do this together. We did it facing down a surge in March and again in July. I know we're all tired, and it's easy to become lax with mask wearing and being socially distant. I talked to someone last week who was at the end of their rope, these masks. They're uncomfortable, they told me. They're sweaty. It's difficult to communicate. They're just a real pain. And my response, in not so flippant way, is you know what else is uncomfortable? Being intubated. Seeing a loved one on a ventilator. We have the chance here as the community. Today's event is not to panic, but to sound the alarm and a call to action on behalf of this community to protect our loved ones and those that serve us on the front lines as they continue to take care of our neighbors during this pandemic. Columbus will continue to encourage wearing masks with the help of public-private partnerships. We've spent more than $350,000 to supply masks to city workers, partner agencies, and community organizations. To date, the city has given away 282,000 masks to the public. We still have around 100,000 masks to distribute. I'm also announcing today that we as a city are committing $1 million of CARES Act funding to serve as a public education and awareness campaign in these next critical weeks. Each of the physicians talked about this moment that we have to slow the spread and deal with the surge in the appropriate way. This campaign, we're asking for public and other private partners to join us because we know we are not done with this battle and we cannot do it alone. I will emphasize again that what our future looks like from a public health standpoint depends on what each and every one of us do right now. Recommit to being vigilant about wearing a mask, avoid large gatherings, and wash your hands. I'll be happy to take some questions for myself or for the physicians here. Yes?
I know that you're talking about encouraging people to do the right thing, and that's great, but I mean, like, on Saturday, are you going to be working with CPD to, have them mobilized and out and breaking up parties if they see people gathering in larger crowds than they should be? Are you going to try to get them to be out more so than they would be on any other Saturday?
We will continue to do a lot of the work that Public Health and Division of Police have been working on. I'll ask Dr. Roberts maybe to give an update a little bit on what we did last Saturday, what we'll be doing this Saturday, and in the months past around large gatherings.
So thank you for this question. We've been preparing for this game for several weeks since we knew it was going to take place. I had a team of staff out this weekend. We did 116 compliance checks on Saturday, along with CPD and OIU. Of those 116, we only found 2 that were in violation, and they were issued a warning. We continue to work with our partners at Ohio State University. It's a challenge. We know our businesses are doing the right thing. It's a challenge to control what people are doing in their private residencies. And I think that's more of what you were alluding to, is what's happening on people's private property. And that's a big challenge for all of us, whether we're in public health, government, or any other aspect. What you do in your private property is really up to you. But we will continue to work with our community partners, our businesses, as well as with the university moving forward.
Follow on that, it would seem that the police should be able to break a large party. I mean, they can do that when it's just too loud, right? But then also, one of the things that I constantly hear from people in these settings, that they'll be outside and they won't have a mask on. Like, we're outside, it's fine. We're keeping some distance. How would you respond to those people making that argument back to you that what they're doing is actually fine.
Well,
Not quite.
Well, I can respond to the outside parties part. I think people need to realize that, yes, outside is better than inside. There's no doubt about that. But you still need to keep that 6 feet. And so 6 feet needs to be maintained because just because you're outside doesn't negate the fact that you don't need the 6 feet. So outside is one thing, but still need to keep that 6 feet and you still need to wear your mask. The virus can be spread outdoors. That's a possibility. And so we can't forget that when we're socializing with other people. And that's why when you see spectators at different events, you are sitting in clusters with your family members. You're not seated next to someone who's not part of your household unit. That's, again, to maintain that 6 feet, even though you're outside.
I have a question for you, Dr. Roberts, while you're at the podium. About half of Ohioans want their kids back in schools. Also, about half say their kids have been set back by virtual learning. The governor says that students are wearing masks and distance in classroom. There's not much risk of spread. It's more so happening outside of school. So with that in mind, why is Columbus City Schools scaling back its shift in person?
Well, I think that's a question for Columbus City Schools. The data does show that kids are safe in the classroom, but as we said last week when we spoke to this, and as Columbus City Schools said, they've got a large operation, one of the largest in the state, and it's challenging to try to move 50,000 kids safely into the classroom, and so that's part of the challenges they have. But they are bringing some kids back next week. I want to make that part clear. They are bringing some of their students back next week. We continue to work with them, and we're also working to make sure that they can bring even more students back come January of 2021.
You say there's only 2 violations that were found. Does CPH only have jurisdiction inside an establishment? Because what we saw was, maybe people are seated far apart at the bar, but on the sidewalk outside were these huge crowds and very close lines. Is there no enforcement authority over the public sidewalk?
Well, I say that the sidewalk, what we saw or what many saw on the sidewalk, was a sign that the restaurants were doing the right thing inside the establishment. They were controlling how many people they allowed into the establishment and making sure they were able to keep the 6 feet of spacing from different parties once inside their establishment.
So what about what's going on outside?
I will admit, outside is a challenge. Outside is a challenge because these businesses have been stretched already, and so trying to maintain the line outside as well as their patrons inside can be a challenge for them. We work with them, we give them ideas of how they can control that, but it's really, a lot of it is up to our behavior and how we maintain the line, and so we try to keep the social distancing. But we do encourage our businesses as best they can to control the lines outside, but most importantly, we're worried about how they control the atmosphere inside their establishment.
With regard to some of these large gatherings that I know the mayor referenced outside of people's houses on game days, some 50 people, maybe even more, how concerned are you that that will lead to an even greater spike? If there is a spike, when would we start to see that from Saturday's game?
Well, any gathering of any size greater than 10 concerns me, whether it's on game day or any other day. Some of the pictures I saw over this weekend, I'm very concerned, and I would anticipate that if it leads to more cases, we would start to see that increase in the next 5 to 7 days from now, or from Saturday.
Is there a concern that those cases would then spread into the greater community, for example, just off campus into Columbus and Franklin County?
Whenever there's one case, there's a concern that there's going to be more cases as a result of that. So whether they're just isolated on campus, we know that many of our students and even those who attended the party aren't on campus. They're living elsewhere and they're working elsewhere. And so it could spread anywhere in the community. So yes, there is a concern that it could spread outside of the campus area.
I guess the one point I would add, I know talk a lot about football here today, and I've done my part, but this surge that we're seeing is not because
solely of Ohio State football. And so, we have to recommit to how we need to live with this pandemic and the precautions we need to take, whether or not, it's football games or, how we interact with our colleagues, and our neighbors in the community. It means that we have to work, worship, interact with others, shop differently. And that does not go away. This pandemic is not going away. And so as a community, we have to recommit to doing things differently. And I think this is a very critical time, not just with Ohio State football coming back, but with Thanksgiving and the holidays right around the corner. People need to plan differently to celebrate and enjoy those things in a different way. Halloween, trick or treat for Columbus and many Central Ohio communities is Thursday. We need to plan differently to take care of each other and to do our very best to flatten this curve as we enter these critical couple of weeks.
Does the city have adequate enforcement mechanisms? Because I'm just thinking, like you said, 116 checks, only 2 violations. I'm hearing from you when it comes to parties on private residences, even if someone is seeing that and it's obviously a problem, it sounds like the police don't really have much that they can do if it's on private residence. So does the city have what it needs to enforce this?
I believe so, and I think, from the compliance that Dr. Roberts, and I'll let her speak to what she's seen with her team from the very beginning. I think at one point, with respect to masks, there was and with checks, about a 95% compliance over the last several months. That has not necessarily gone away. But as the governor has said, and public health officials and medical experts from around the state, what we are seeing is this connection between small gatherings in private residences, sometimes not so small gatherings in private residence, but there are they're a big challenge. There are constitutional challenges with respect to enforcing the health orders, and that's where we need the public's help to do the right thing and to make sure they're protecting themselves, their families, but also their neighbors. Do you want to speak to enforcement?
So I want to echo what the mayor said about this spike was observed well in advance of this first OSU football game, and that is absolutely true. And when we look at our data, we ask our cases, did you attend a mass gathering within 2 weeks of your onset of symptoms? And what we found is 32% of our cases say that they went to a party. And that party could have been at a private residence, it could have been at another establishment. It's hard to say how they define a party. Another, I think, 20% said they went to a wedding. So these are individuals who are going to gatherings. Mass gathering is anything 10 people or more. That's the part we need to control. That's the part we really need to discourage our residents from partaking in. And what people often think is just an innocent little gathering with a few of their close friends ends up being an outbreak with many, if not all, of their close friends that attended that party. So again, we are really encouraging our residents to rethink your plans for Halloween, keep it with just your household members, rethink any plans you've already made for Thanksgiving, making sure that it's just your house members, as well as rethinking Christmas and any other holiday between now and then that people are going to be celebrating. These are challenging times, but we have to start behaving differently. We cannot go back to life as we knew it before February and March of 2020. And then the compliance checks, I will just add, we continue to go on complaint-driven compliance checks as well as random compliance checks with CPD and OIU for bars and restaurants. And what we found is the majority of our bars and restaurants have been in compliance, whether it's been with masks for not only the employees, but also the patrons, or with social distancing. Yes, early on, we had some challenges with some of our establishments. They were learning. This was a new way of behaving, a new way of doing business. But since those first few weeks back in May when the state reopened, we have found much more compliance with many of our businesses. Again, it's a 95% compliance with restaurant and bars as well as with mask usage.
Question for Dr. Thomas. I'm wondering if you could talk about what you think is driving this surge of cases and hospitalizations, both in Central Ohio and in the Midwest. It doesn't seem like there's all that much different from 2 months ago. Obviously, obviously back to school, back to college, the weather's getting a little colder, but what do you think is driving this?
That's a great question. I think we're all struggling to figure that out. The general consensus is that as the weather's gotten colder, people are having these gatherings a little bit more indoors, or they're just more indoors. We see this pretty much annually with flu season, where the flu season gets worse as you get further into the winter, because there are even some mechanics of how the virus hangs in the air based on the humidity and other things that do make it a little bit more easier to contract in a drier time of the year. But it's most likely people coming indoors. There is probably some impact of those K through 12 cases that Dr. Roberts was mentioning in younger children, when those folks who may be less symptomatic or asymptomatic might be around an adult. But it's not like there's widespread transmission within schools or within the classroom itself. I think one of the key areas, I mentioned the more rural districts of the state. I think if you look at the public health advisory map, back in the summer when that map was first put out, some of the larger counties were the ones that were red. Now that is much more evenly distributed across the map of the state. For a number of weeks, Franklin County was in the top 10 of cases per capita. I believe now we're 35th or something like in the 30s out of 88 counties, where a number of the smaller counties, more rural areas are at that higher incidence rate. So when you think about the patients that are at Ohio Health, Ohio State, or Mount Carmel, and also at Children's, a lot of those folks actually don't live in Franklin County. We take care of them because they need either a certain level of care, or the hospital where they live is just has too many patients to take care of them, so they move them to Franklin County. But in the rural areas of the state, they were not hit nearly as hard in the first two phases of the pandemic, and I think the use of masks is probably a little bit lower, or has been. We're hopeful that the messaging that we're getting out now about the importance of doing that is going to get across to folks that haven't had to deal with this as up close and personal as maybe we have in Cleveland, Columbus, Cincinnati, and some of the other large cities of the state. So it's probably a combination of multiple factors, but those would be the key ones.
What is the current hospital occupancy, and what kind of threshold do you foresee of, how many hospitalizations per day would get you in the trouble zone, and would there be another shutdown of electives?
Thank you for the question. To take the last part first, I don't think anyone at this point is anticipating a widespread lockdown on elective procedures or elective care like we did back in March. We can talk more about that if you'd like, but I don't think that's in anyone's plans. As we have both our local calls that Dr. Roberts and Joe Mazzola run every Monday and Thursday, we all talk about capacity multiple times per week, and then we also have these discussions on the zone calls every Monday, Wednesday, and Friday. At this point, I'm not hearing from anyone that they feel their entire hospital is too full. All of us, at least of the hospitals represented here, would say we have surge capacity inside our facilities, both in terms of maybe a unit that's been closed or some beds that are under renovation that we could bring back into operation in order to meet a surge of patients. That being said, we are also anxious that if it doesn't peak and start coming back down, at some point there is a breaking point. But we are far from that, Carrie. I think that we are preparing for the worst case scenario, but at this point we are not more than just in preparation mode. And we feel like we have adequate capacity to manage both COVID patients as well as non-COVID patients without a problem in our community.
Question you had about rural communities and why maybe some of those hospital numbers are going up. Every Monday, the governor speaks to the health commissioners, and one of the first questions he asks us every Monday morning is, what's your mask compliance like? And we've been having these calls for at least 6 or 7 weeks now. And notoriously, the big cities, Columbus, Cleveland, Cincinnati, all say our mask compliance is great, 80, 90, 95%. But the smaller jurisdictions have been struggling with mask compliance. And I think what they're seeing now in their cases is a red flag for them, like, oh my goodness, and they're starting to get more compliance among their residents. But if you recall, we were seeing a significant spike here in Columbus in late June, early July, and the mayor called for a mask order on July 3rd. We saw a significant decrease in cases here locally once that mask order went in place. And so we used that tool, it was effective. In addition to that, the governor then did the early last call for bars, and that happened, I think, around July 20th, if I'm not mistaken. We saw a 37% reduction in cases here in Franklin County about 2 weeks after that took place. And if we looked at just the ages of 20 to 29%, we saw 20 to 29 years of age, we saw a 50% reduction. So we've used those tools, and those have been very effective for us here. We're kind of out of tools now, and we're really calling on our residents. Now it's your turn to step up, because we don't have very many interventions left in the toolbox.
With cases spiking and potentially with more cases at Ohio State, potentially from some of these parties or tailgating, could it impact if the Buckeyes are able to continue to play football? Is there any rules as far as the Big Ten, just kind of going forward?
So the way the Big Ten has currently put their guidance out, they're primarily just looking at the positivity rate of the team and of the campus. The Big Ten health commissioners have gotten together, and we've asked the Big Ten to consider the community aspect of the disease spread. It's not clear whether the Big Ten is going to take our advice or not, but we have asked them to look at the positivity rate in the community, as well as the cases per day per capita in the community, to consider whether the game can go on in that community. Not the team, but could the game go on in that community?
Thanks, everybody.
Thanks, you guys. Thanks, Nick.
Yeah, thank you.